Good morning, everyone. On behalf of FCPI and Clinical Research Forum, welcoming you all to yet another basic module session on mastering observational studies, cross-sectional, cohort, and case control insights. I'm Adeline Maria Simon, a member of the FCPI Clinical Research Forum. It's my great pleasure to introduce you, our speaker for our session today, Dr. Jagriti Yenpure, Research Project Coordinator, Respiratory Research Network, Pulmocare Research and Education Foundation. Dr. Jagriti Umesh Yenpure is a dedicated and detail-oriented research project coordinator with a Doctor of Pharmacy degree and extensive experience in clinical and academic research. Her expertise spans across various facets, particularly in respiratory diseases. She is passionate about advancing public health outcomes through impactful research opportunities. Dr. Raghuthi has been involved in multiple projects and assertions related to respiratory diseases and inhalers. She holds multiple certifications in research and has been recognized in competitions and both national and international conferences. Dr. Jagriti will be sharing with us on observational studies, a much vital study type to gather real world evidence. I once again welcome Dr. Jagriti to lead us in the session today.
A very warm good morning to one and all. Thank you, Adalyn, for a very brief introduction, and thank you, FCPI, for providing me this platform for today's presentation. So today I'll be presenting on mastering observational studies, cross-sectional, cohort, and case control insight. So before we go dive into the types of the study design, firstly we will see the background of the uh, epidemiological studies. So, what are epidemiological studies? So, epidemiology is the study of how a disease is distributed in a population and what are the factors that influence or determine this distribution. So, when we divide this word into three different parts, epi meaning among, demos meaning people, logos meaning study. So, together it will simply mean study which is conducted among people. So what are the objectives of epidemiological studies? So it mainly focus to identify the causes and what are the risk factors of the disease or the outcome that we are focusing on. Then it will measure the disease burden. Look into the natural history of a disease and its prognosis on the population. In that we have studied till now, it will guide future public policy and it will help for the prevention of the disease in the population. So now we will see the 5 W's and H framework, which will systematically the person or the people who are needed to be involved in our study. We need to identify them initially. Then what is what is the risk factor? What are the causes? We need to identify them. What are the legal parameters we need to get this? Then we decide what we will get a target study to be started. This to be decided. Then we will go where the study is needed to be conducted. It will decide the place of the area where the study is needed to be conducted. Then we will go towards the why and how. Decide to Yeah, I'm so sorry. There was some technical issue. So now my slides are visible. Hello?
Yeah, it's visible.
Slides are visible.
Yeah, I will continue. So we were looking at the frame 5Ws and H framework. So here, in how and why find and here, epidemiological studies are broadly classified into two different types, observational and interventional. So, observational studies are also further classified into descriptive and analytical types, and the both subtypes are further divided into two various subtypes. We will discuss them in detail after completing this slide. Firstly, we will go on the interventional or experimental study design. So, what are interventional epidemiological study? Here, the investigator will establish any intervention. They will introduce the intervention in the population of their interest and will conduct the experimental study. And here, the investigator mostly study the intervene and will study the outcome of that introduced exposure or the intervention. So this is broadly classified into three types, as randomized control trial, quasi-experimental, and community trial. So in randomized control trial, it is widely used for conducting establishing any new drug, and it is classified into four phases of a clinical trial. So in randomized control trial, the investigator will will introduce the investigational drug or any investigational device that they need to analyze, and the patients will be randomly assigned to the investigational drug. So here the two groups of patients will be formed. One group will be interventional group and the other will be control group. So interventional group will be the group where the interventional drug is given, and the other group, the control group, will be the group where the placebo medicine will be given. So there will be no active pharmaceutical medicine will be given. There will be just placebo medicine to compare the effect of our interventional medicine. So here the major part is randomization. The second point is quasi-experimental. Here the difference between RCT and quasi-experimental is just that both methods involve intervention, but in quasi-experimental there will be no randomization. So here the investigator will intervene, but there will be no randomization. So for example, we can take that if we introduce a no smoking campaign in one city and we'll compare that data with the another city where the campaign was not undergone. And here there will be no randomization. We are just comparing the two group to understand the our intervention. And in RCT, we will compare the randomized patient to found our outcome of our disease. And in community trial, the unit of analysis in this type of epidemiological study is a community or a group. Here, no individuals are not involved. Here, the group or the community is involved. And this study are mostly used for the large scale public health intervention. And for example, we can take here that the fluorides which are added to our community water supply. Here the intervention is done. The fluoride is added to our community water supply for the prevention of the dental caries. Here the intervention is directly done by the government or the a bigger group of community trial, but the individual is not involved. Now we will see in detail the observational study design. So firstly, observational study design is where an investigator observes the exposure and outcome without assigning any intervention. Here, interventional interventions are not done. So major difference between observational and intervention is uh, uh, observational study will where the investigator will only observe what are the outcomes of the study. And in interventional study, the investigator will initiate an intervention. They will expose the patient to an intervention and will analyze, will look into the outcomes of that study. So observational study is where the investigator will observe the exposure and outcome without assigning any intervention. So the major purpose of our observational study is to understand the natural disease course, how the disease is giving its impact in the population, to identify what are the causes and risk factors and what are the protective factors of that disease, to generate a baseline hypothesis which will help for the future research, and to evaluate the real world effectiveness and safety of the patient. Now, in real world setting, observational studies are used to conduct a disease surveillance or to analyze the national or worldwide burden of that particular disease of interest. Then we will identify the risk factors which are involved in that disease, to study any rare exposure or outcome, to analyze the post-marketing surveillance. So it's a step where a drug came into the market after its clinical trial, all the approvals and all that things are done. In post-marketing surveillance, we will check the after effect of the drug in a specific population. And it can also guide for the healthcare and policy decision. So now these are two different types of observational studies: descriptive observational study and analytical observational study. So descriptive observational study describes the distribution of a specific disease or any healthcare outcome of our interest in terms of a person, place, and time. Here the hypothesis is not tested. Here, this step will help to generate the hypothesis. This is the baseline of any observational study. Descriptive study, if you remember, I have shown the third slide where I have mentioned the 5 W's and H framework. So from that framework, descriptive study will answer the question of who, where, and when. These 3 questions will be answered by our descriptive study, and it is mostly useful to provide a baseline data for future research. It will generate a baseline hypothesis, and it will give a guidance for the analytical study. Now, the second type of observational study is analytical study. So it will majorly aim to identify the association between the exposure and the outcome. Descriptive study will give the distribution and baseline data, and analytical study will analyze that data. Now, from the 5 W and H framework, analytical study will answer the question of why and how the study is needed to be conducted. Now, the use of the analytical study is to test the generated hypothesis from the descriptive study. It will test the hypothesis. It will evaluate the causes, and it will determine the risk factor of that study. Now, in short, we can say that descriptive study will measure and report the pattern of the disease, and analytical study will test the cause and effect of that disease. For example, if we take a classical example of smoking, descriptive study will answer how common is smoking in India, and analytical study will answer does the smoking is descriptive study, and analytical study will take it forward. Now we will go towards the explaining different types of the descriptive study. So descriptive study is classified into 4 types: case report, case series, ecological studies, and case cross-sectional study. So first is case report study. So case report is a detailed description of a clinical presentation, diagnosis, or treatment of a single patient. Here the report is generated based on the data of only single patient. For example, say we are taking a data of a patient with diabetes and hypertension. So the data of a case report will only involve data of only one patient. It will focus on any unusual, rare, or novel findings that needed to be highlighted, which will add a value to our existing literature. The case reports are used to find rare or new disease presentation. If any unexpected ADR, which is not previously established from the trial, if we find it in the post-marketing surveillance, then the case report can be used to present the unexpected ADR. Any new drug interaction, if we find, that can also be presented through case report. Unique therapeutic approach is a thing. Every drug have a published established therapeutic effect. If a medicine shows any new additional therapeutic approach, then it can be presented through the case report, and novel diagnostic technique can also be presented here. Now, what are the advantages of the case report? It's quick and inexpensive to write because it does not involve any set of patients, does not involve any recruitment procedure. It's a simple one patient data that we need to explain. And here, early recognition of new disease or ADRs can be showcased. It will help to generate a baseline hypothesis for future research. It will contribute to medical education as well. And now, what are the limitations? So here, there is no comparative group. Here is no control group. So we cannot infer any causality. Does that patient's data is really that accurate? If we are going for any rare disease condition, what if that rare disease condition is only observed in that one patient? It cannot mean that the rare disease condition will occur in whole population. It's not that valid, but it can add value to the literature search. So there is no control group, so there will be cannot infer any causality. It is based on one patient, so there, as I told earlier, it will limit the generalizability. And here the bias is introduced from the subject to author, because if I am author of who is publishing a case report, then it's in my hand that I will decide that which case to be recruited, which case, how the case is needed to be presented. If I found any factor which is not giving me precise result, I will remove that point. So it's in my hand that author bias is introduced in this case, this type of case reports. Now we will see a structured format, how a case report should be presented, or how a journal style case report should be formatted. So initially, in title, you should mention a concise, specific, and informative title, which will give a specific information on what condition, on what intervention, or what unique feature you have conducted the case report. Now, going towards the format, it can be unstructured or structured. Unstructured meaning you can write the whole case in one paragraph, and for the structured format, you can divide the abstract into aim, background, result, methodology, that kind of sections. So it can be structured and unstructured as well. So your abstract should highlight why you are presenting this case report. It should highlight the unique feature that you are introducing. In introduction, you should give the brief introduction of what the condition you are looking at, then why the case is rare, why it is needed to be addressed. That should be highlighted in your introduction, and obviously you should mention the objective of your study. In case presentation, you should give the detail of whole detail of your patient, like patient demographics, what was their clinical history presentation, what was their symptoms, what was the diagnostic workup done, what treatment and intervention given to the patient. Does that treatment given to the patient work on that patient? Does it give the proper outcome that we were looking for? And the ethical consideration. So your whole detailed case presentation needed to be evaluated. Now in discussion, you will compare your finding with the existing literature. It will give a comparative point of view to the audience, and it will highlight your literature, highlight your work by comparing it with the other already existing work. And you will have to explain why your case is different from the already existing literature. And if possible, you can also mention the mechanism and in detail explanation of your case report here. And in conclusion, you should be short, clear, and concise, and you should recommend that the case report that you are presenting, it should be taken forward, and more research can be conducted on this point. Now, here are some examples of case report. The first example is of a case where a 77-year female with the MDR pulmonary TB, she had a MDR pulmonary TB, and due to the linezolid treatment, she was introduced with the disease called as pancytomania, and also she got the fatal lactic acidosis. So it's a presentation of adverse drug reaction of linezolid. So in this way, you can present the adverse drug reaction in the case report. And the second example is of rare presentation of a disease. So we all know that COVID-19 caused a really big pandemic. But COVID-19 in this patient, COVID-19 presented as a acute pancreatitis, and this was confirmed because the patient did not have any other risk factor, other diseases. The patient only had COVID-19, and that was presenting as a acute pancreatitis. So these are the examples where you can present. Likewise, you can present the case report. Now, the second type of descriptive observational study is case series. So, case series involves a group of patients who have similar diagnosis, exposure, treatment, or outcome. So, major difference between the case report and case series is that case report is the data of only one patient, and case series is the it will summarize the multiple cases which will detect a similar pattern to be analyzed. And the use of the case series is it will describe the uncommon presentation of a disease, it will identify early safety signals of a new drug, and it will highlight the treatment outcome in special population. It will explore the rare complication or any ADRs. Now, what are the advantages of case series? It is easy to conduct as we are going to just extract the data from already existing clinical records. So it will be easy to conduct. There will be no hassle to collect the data. And it will provide a real world evidence because we are collecting the data of actual patients. So it will give us the real world insight, and it can highlight the rare condition, and it will guide the future research because if a rare condition is occurring now, it can probably occur after some years, and not compare our data with second hand, and there will be no causality. Here, there will be selection bias, similar to the case report. If I have a set of 15 patients and my sample size is 10 patients, so from that 15 patient, I will select the best case, case or the best patient who will give me the proper significant data. I will not select the patient who have any comorbidities or whose data is interfering with my results. So bias, and they not calculate the incidence or prevalence precisely. Sorry. Because you are recruiting the patients from the already existing data, you cannot define that the collected cases are the incidence or the prevalence. Incidence is the occurrence of the new disease, and prevalence is the occurrence of the already existing patients. So we cannot actually calculate the incidence or prevalence from this case report studies. Now, going forward, this is the structured journal style presentation of your case series. In title, you should mention what intervention or unusual presentation you are showcasing. In abstract, it should be structured, not like case report. You have to structure your abstract into the background, methodology, result, and conclusion sections. You will have to emphasize the pattern or the trend that you are observing through this set of cases. In introduction, you will have to mention in background detailed explanation of the disease that you are focusing on. And here you will have to add a research gap statement. What research gap you are addressing that needed to be highlighted here. In method section, you will have to mention how cases were identified. What was your methodology? What was your inclusion exclusion criteria that need to be explained here, and how the data collection was initiated. In result section, you will have to summarize your whole data. You can use tables, graphs, figures for the representation of your whole data, and you will have to uh, mention a clinical presentation of your patients sim are in terms of similarities and differences, which will give a very descriptive way for your presentation of your case series. Discussion will compare, here you will compare your results with the existing literature to give a concise view of your case series. And of course, here you will have to mention the importance of your study and the limitations of your study as well. And in conclusion, you will have to state a statement where it will highlight your work and it will give a future directions. So here are examples of case series. So first example is of a Kaposi sarcoma in patients with HIV or AIDS. So this is a case series which was collected from a tertiary care hospital, from a single hospital. The data of 51 patients was collected from a single tertiary care hospital. So from this study, they showed that Kaposi sarcoma is a rare disease which needed to be taken care of and need more search on the topic. And the second example is of a multi-center European study which highlighted the common early symptoms of olfactory and gustatory dysfunction in COVID-19 patient. So they highlighted the need of this olfactory and gustatory dysfunction in COVID-19 patient. So the major difference between these two examples is that the first example is where the cases are collected from a single hospital, and the second example is of cases are collected from the whole Europe. So the case series can be connected both ways. Now the third type of the descriptive observational study is ecological studies. So this here the unit of analysis for the study is population or a group of patient. In case report and case series, we were recruiting individual patients. In ecological study, here we are going to collect data of a population, whole population or a group. Now, here researcher will look for the correlation between the exposure and outcome at the group level. Here the groups are studied, and the uses of the ecological study is it will study the environmental exposure, because we are going to involve the group of population in our study. So it will study the environmental exposure. The interventional comparison of the disease prevalence can also be studied here. It will give a early exploration before individual level study, and it will study the exposure that are hard to measure at individual level. So this last two statement means that ecological study comes between the individual study and the group study. So if we are unable to conduct an individual study, then we can go for the ecological study, which will give a baseline for the future individual study. And it can also be a preliminary step for the group study. So ecological study ideally comes between the individual study and a group study. So it's a kind of a baseline for both type of studies. Now, the advantages of ecological study is that it is quick and inexpensive here, because we are collecting the data from whole population which is already existing, and it is useful for generating new hypotheses. It can reveal the population level trend, because the population is involved in this study, and it will help definitely help for the development of the policy makings. And the limitation of this study is that ecological fallacy. What is mean by ecological fallacy? Um, because we are recruiting a whole population does not mean that the features, the disease that the population shows will be similar to a individual level. We cannot compare a group to a individual. So the ecological fallacy will occur here is the limitation of this study. And the confounding variables, the contributing variables which will hamper the results of our study are difficult to control in this kind of studies, because a lot sample size is more. So confounding variable will definitely interfere in our results. We cannot establish the causation, the relationship of cause and effect in this kind of studies. Next is journal style representation of your ecological study. You will have to mention the exposure, outcome, and group level analysis in your title. This needs to be highlighted in the title. Group level analysis. In abstract, it should be structured and highlight what work you have done at the group level. You in study design section, you will data source from where you extracted the data, what was the exposure and outcome that you studied at the group level. In results, you will have to in forms of text, plots, graphs, or maps as well. And in discussion, you will have to interpret the findings in context of literature. You will have to compare your data with the previous literature, and you will have to explain the ecological fallacy also that I've mentioned earlier, that it's the limitation of the study, so it need to be highlighted in discussion section. And in conclusion, you will just state that it's the recommendation for the future studies. It can be used for the future research. So this is the example of ecological study. So the title says the smoking gun. The study is that the policy of the nation because of this study. So this is a population level study, an ecological study, which highlights the need for the studies like this. Now the last fourth type of descriptive observational study is cross-sectional study, which study the exposure and outcome at same time of point. We will collect the data from a group of people of the exposure and outcome as well, both at the same point of time. And it measures the burden of the disease or risk factor at only one single point of time. So that's why it is called as prevalence study. So the use of the cross-sectional study is to estimate the prevalence of a disease or risk factor. It will help us to understand the healthcare behavior or any medication pattern. It will explore the association between the exposure and outcome, and it will also will guide to form the pharmacoepidemiological and public health policies. Now, this is the structure or the flow of the cross-sectional study in which we will conduct it. So firstly, we will look at the whole population. So from that population, we will sample out the uh, group of patients or group of population of our interest. Suppose we are collecting data of patient with hypertension. So from total population, we will extract the data of only patient with hypertension, or the history, who have a family history of hypertension. Now we will divide the whole group into exposed and unexposed population. We will divide the patient with hypertension and without hypertension. And now we will, in this both exposed and unexposed group, we will look for the development of our exposure is hypertension, and we are looking for the outcome of for the heart attack. If the does the patient with hypertension have a heart attack? So both our exposed and unexposed group will be looked for the outcome of heart attack, and we will see for a period for that point of time, does they develop the outcome or not? And we will analyze the risk of outcome and exposure in both groups. It is relatively quick and inexpensive. It is good for descriptive epidemiology because it gives a insight of whole description, and it is useful for healthcare planning and for the location. It will be the baseline study to establish any temporal relationship, because the data is collected at one time of point. We cannot say that there is a temporal relationship between the exposure and the outcome. We will measure here, this study will measure only prevalence, not incidence, because we are collecting data at one time and we are going to observe the outcome. We cannot say that the study will give the data of the incidence. It will only give the data of the prevalence. Here, it is more susceptible to confounding and superior survivor bias. Here, the bias is introduced by the um, confounding factors. This is the journal style representation of the cross-sectional study. In title, you will have to be clear and concise, and you should mention exposure, outcome, population, and location. All these four points should be there in your title. Abstract should be structured and it should highlight the key association and significance that you are presenting in your cross-sectional study. In introduction, it should be brief. The background should be mentioned in a detailed format, and in method section, you will mention what was the inclusion exclusion, give the detailed explanation of your whole collected data, your what prevalence was estimated, what was the association, who were the participants, and what was the result of their participants. All the results should be mentioned here. In discussion, you will compare your findings with the previous finding and will interpret your association carefully. And here you also have to mention the strength and limitation of your study. And in conclusion, you will give the recommendation for the future research and what was the key finding of your whole cross-sectional study. So this is the example of cross-sectional study. The first is global burden of hypertension, which analysis of a worldwide data. So this was a study conducted in 2005, which estimated that 972 million people was affected by the hypertension. And they forecasted that in 2025, the almost 60% will be rising this value. That is 1.56 billion people will have hypertension in 2025. So this kind of study is a forecasting study. We will collect the data. We will analyze the data, we will find the prevalence of that particular condition, and we will give a future direction that this may occur. And the second example is the National Family Health Survey, which is conducted in India widely, which provides a concise report of our population from the health and nutritional perspective. And this kind of and this is a major work done by our government, which helps to guide the policies. Now let's have a revision of our descriptive observational studies, what we have learned till now. So case report, it is a story of a one unusual patient. This year, only one patient will be involved, and it focus on the rare or novel findings. And the example here we can take that a rare ADR in one patient. The second type that we saw is a case series. It's a small group patients where we see the same pattern. A group of patients where the same pattern is seen. And here the focus it focus mostly on the trend across patients. And the example here is 5 patients with same ADR. Third type that we saw was ecological study. It's a group level comparison where the population level trends are mostly focused. And the example that we can take here is air pollution versus COPD death across state. And the last type of the descriptive observational study is cross-sectional study. In short, it is a snapshot in a time. It's a snapshot of the whole population in a time, and it focuses on the prevalence and association of the disease. And the example we can take here is asthma prevalence survey in India. So, in short, the take-home message from the descriptive study will be that descriptive study is the first step to identify the pattern of the disease. It will generate a baseline hypothesis, and it will guide further the analytical research. Now, the second type of observational study design is analytical observational study. So, analytical observational study has divided into two types: cohort study and case control study. So, first we will see cohort study. So, cohort study is a study where a group of individuals who don't have the our interest of outcome, they will be collected at baseline. Means, if we are going to conduct a study on anemia, so we will recruit a set of patients who don't have anemia. And at suppose I am collecting data in 2000. I have collected my patients, a set of 100 patients of in 2000 who don't have anemia. And I will follow that patients for a particular period of time. Suppose I am going to follow that patients for 5 years. And for after 5 years, I will see how many patients developed anemia. So this is a kind of study where we collect the data in baseline, follow the patient for the particular time frame, and see if our outcome of interest has developed in the patient or not. It is particularly classified according to exposure and status. And we will observe the outcome of the disease and will compare them in the both group. So the use of the cohort study is it will estimate the incidence and natural history of the disease. It will assess multiple outcome from a single exposure. Our aim is to find anemia, but what if the group of patients that we have recruited will show more other symptoms? So our exposure is single, but we are going to observe a group of outcomes from the single exposure. And we can also establish a temporal relationship from this type of cohort study. It will evaluate the rare exposure. It will provide a stronger evidence for causality, and as compared to the case control or cross-sectional study, it is the main study which mostly used, and it is more useful for the policy making and guideline making. So this is the flow of a cohort study which is conducted. So at baseline, we will collect the data from the whole population and will divide the group into exposed and unexposed group. And after that, we will follow the whole group of patient till a particular time frame, and will see if the disease have developed or not. The advantages of cohort study is that is temporality is established here. We can measure incidence. In cross-sectional study, the incidence was not measured. Only prevalence was measured. But in cohort study, we can measure the incidence because we are following up that patient for a particular time frame, and we are looking at the development of the disease for the incidence of that disease. So here the major advantage of this is that of this study type is that it measures the incidence, and we can also find out multiple outcomes from single exposure. We can also focus on rare exposures in this type of study. Now, the cohort study is a base study. It can also be help to conduct a nested study. Nested study as in we will take a small portion of a cohort study and will conduct a separate study. It is meaning by the nested study. So nested studies are possible from the cohort study, and it will help to understand the natural history of the disease as well. In limitation, we can see that this study have a lot of time consumption because we are going to follow up the patient. So it is a time consuming process. It is expensive because the duration of the study is more, and the patient follow up is really a task. and it is ineffective for rare disease. It is useful for understanding the rare exposure, but for rare disease, the rare disease does not occur every single time. It may occur in 10 years, it may occur in 1 year. The specific occurrence of the rare disease is not specified. So rare disease cannot be studied by using the cohort study. There will be loss to follow because we are collecting a larger sample size. Some patient may be lost in between. We cannot follow get the whole set of patients till the follow. There will be changes over time, and there will be definitely bias in the whole process, and it will require a larger sample size. Now, the cohort studies are further divided into three types: prospective, retrospective, and ambidirectional. So what is prospective? It will look into future. Here, the data will be collected from the hospitals, and the strength of the study is that it will have a strong temporality, and it will give the result of accurate exposure. And in limitation, we can say that this study is costly and have a longer duration of time. This is the whole limitation of our cohort study. So the prospective study look into future. Now, the retrospective study will look into past. What will the retrospective study will do? If I am doing a retrospective study, what will I do? I will go to a certain hospital. I will dig into their already existing records, already existing data set. I will take that. I will filter out all the patients that I need of my expected outcomes and exposure. So retrospective study is a kind of study where we collect the data from the already existing set of record, and then we will observe for the outcome. And this is the strength of the retrospective study is that it is quick, cheap, and good for long latency. And the limitation is that we don't know how the data was collected previously. We were not there for to check the data of their past records. So that limitation here is common because we don't know the quality of the data that we are collecting from the already existing records. Now, the third type of the cohort study is ambidirectional. This study is the major advantage of the cohort study, that it goes in both direction. It can collect data from the past also, and it can go in the future direction also. The strength of the ambidirectional study is that it is efficient, and it combines both prospective and retrospective as well. And the limitation is that obviously it's a complex design. Now, this is the journal style representation of a cohort study. Your title should be clear, and it should indicate what was the exposure and what was the outcome. The abstract should be structured. Introduction should give the rationale for the exposure and outcome relationship. What was the rationale that you used to analyze the exposure and outcome? And you should mention the gap that you are addressing. In method section, you should mention the whole details of the study design, study population, what was the exposure and outcome assessment, how was it conducted, what was the follow-up period, what was your sample size. That all should be mentioned in your method section. In result, it should have a baseline characteristics of your patient and incidence of outcome in both group. In discussion, you will interpret your whole data, and you will represent it in the form of comparative way with the already existing evidences, and you will give the strength, limitation, and implication of your study. And in conclusion, you will concise a statement with your main findings. Now, these are the examples of prospective, retrospective, and ambidirectional. So for the prospective example, I have taken the example of the Framingham study, which was a landmark study conducted using an epidemiological method. And due to this study, the risk factor before the study, the heart patients, the heart disease were not having any risk factor. But when this study was conducted, the concept of risk factor of heart disease came into picture. So this was a landmark study, and it goes into the future direction. It gives a future direction that heart disease can also have risk factors. Now the second type is retrospective study. So here what they did, that the Japanese atomic bomb radiation exposure patients was taken into the recruitment process. The patients were recruited, and they observed that patient till they uh, showed any cancer symptoms or the death of the patient. So what they did, they collected the patient who have already exposed to the radiation, which is retrospective, and they observe that patient till the outcome of their interest has occurred. So this kind of study is a retrospective study. And the last example is of a ambidirectional study. It's the nurse health survey. So in this study, they took the past history of that nurses and also understand how the lifestyle and hormone factors impact the chronic disease condition of the woman. So this goes in both way. They also took the past history and also followed up the uh, development of the lifestyle and hormonal impact of that whole condition of the on the women's. So these are the three examples with the three types of the cohort study. Now the second type of the analytical observational study is case control study. So what is case control study? Here we will recruit the cases are the individual who have disease of our interest, and they out the interest of outcome. Now what we will do in this process, we will take two groups, exposed and unexposed, and find out followed up for the whole period, and we will see if the patients are divided into cases or the patients are divided into controls. And we will compare the data of both cases and controls for our future outcomes. Now, these case control studies are used for the studying any rare disease. Here, the investigation it will help to investigate the disease with long latency period. The diseases which have long latency period, like if I am dunked by any malaria mosquito, but I will not show a recent at that point, I will not show malaria. It will require time for a latency period for the malaria to occur. So it will be useful. Case control study will be useful for the investigation of the long latency period. It will help to explore multiple risk factors for a single disease, and it will be a initial hypothesis generation process. It will also be useful to understand the outbreak investigation, and when the RCT is not ethically or practically possible, then in that case we can go for case control study. Now the advantages of case control study is that it is efficient for rare disease. It requires a smaller sample size, and it also have a comparative arm. It's less expensive and it is quicker, and it have a multiple exposures that can be studied for one disease. Limitation of this study is that it cannot measure incidence. There is a recall bias because patients may not have the in mind their previous information, they don't recall it, so there may be a recall bias. Selection bias is also there because when we collect the patients for the group, it's in the hand of the investigator to whom to be recruited in the control. Now, case control studies are divided into three types. hospital-based, population-based, and nested case control. So hospital-based case control study is here the cases will be the patients from the hospital, and the controls will be the patients from the same hospital, but will not have the disease of our interest. We are recruiting the patients with asthma. The cases will be patient with asthma, and the controls will be the patient without asthma. They will have the other comorbid conditions, but will not have asthma. And the strength of this study is that it is easy, low cost, and we will have the access to records. And your limitation is that the control arm is not representative, because we are taking the patients directly from the hospital. The control arm here is not representative. Next is the second type of the case control study is population based. So for the population base, in cases we will collect the data from the registries or directly through the community surveillance by visiting the houses of the patient directly, or from the any community setup. And control will be the population, same population which will be uh, uh, included through the electoral roll, random household visit, etc. And the strength of the population-based study is that it is more representative, and it have a generalizability as compared to the hospital-based study. And the limitation is that it is expensive and the recruitment process is difficult, because the investigator will need to go to the doorsteps of every household. It will be a challenge for the investigator to collect the data. The third type is nested case control. So the nested case control is the study where the cases will be, as I mentioned earlier, that the cohort study will be the base for the nested case control study. So here the cases will be recruited from the cohort study. The patients will be recruited from the cohort, and the controls will be the same match controls from the same cohort study. And the strength of this nested case control is that it have a temporality, and here the recall bias is less and it is efficient. And the limitation of this study is that it have a limited exposure, because the patients are not directly recruited as a new set of patients. The patients are recruited from the already existing cohort study. So there will be limited exposure of the patients. Now, this is the journal style representation of the case control study. So it is here the title should be clear and should state what was the exposure and outcome. Next, abstract should be introduction should highlight the gap that you are at, and should state that you the time window that you have considered for your study sampling, and what was the sample was calculated, etc. And in which will give the significance of your collected data. And you will have to mention here how you have adjusted the confounding factors here. In discussion, you will have to summarize your whole finding and will have to compare the identifies the pain, sleep disturbance, and lower educational level as a key risk factor for the delirium patient in elder colorectal cancer. So this was a nested study design. And the second example is a case control study, which was based on the National Health and Nutritional Examination Survey, which evaluated the effect of HPV infection on the bone health of the woman. They evaluated the association between the lower bone mineral density in women and HPV co-infection. So this kind of publications can be done using the case control studies. Now, let's revise what we have learned in the types of the analytical observational study. So first is cohort study. So in cohort study, we saw that exposures, we will analyze the exposure and we will see what will be the outcomes. It will look forward into the future and it will give us the idea of the recruited sample, what will be the outcome. It is best to understand the rare exposure and it is useful for to analyze the common outcome as well. And the strength of this cohort study is that it will establish the temporality, and the limitation is that it is a very time consuming and cost intensive process. And the second type of the analytical observational study is case control study, where we will analyze our outcome first and then we will go for the exposure. It will look into the backward direction. Cohort study will look into forward direction and case control study will go into backward direction. Here, case control studies are used to analyze the rare disease and the disease with long latency period. And the strength of the case control study is that it is quick and have low cost as compared to the cohort study. And the limitation here is that it will have a recall or a selection bias. So the take-home message for the analytical study will be that this study are designed to test the hypothesis that was generated previously by the descriptive study, and it will establish a good association between the exposure and outcome, and it will also provide the evidence for the causality for the future research. So this analytical study is a logical next step after the descriptive study. So finally, to wrap up my session, descriptive studies will give us the insight of what is happening in the our interest of outcome. And it is further divided into 4 types as we have seen earlier: case report, case series, ecological, and cross-sectional. So case report and case series are used to find the rare or unusual finding and early signal. Ecological will give us a group level data and it will generate the hypothesis for future researches. And cross-sectional study will give a snapshot of the exposure and outcome at one point of time. And it's the first step where we will get the answer of who, when, and where. The second type is analytical study, which will answer the question of why the outcome is happening, why the exposure is happening. And it have 2 types, case control and cohort. The case control will compare the past exposure in deceased versus non-deceased patient, and in cohort, it will follow the exposed and non-exposed patient over the time to see the outcome. Analytical study are the next step to understand why and how strong is the link between exposure and outcome. So together, these studies will bridge the gap between hypothesis, evidence, and public health action. So thank you for your attention. I hope this session have gave you a clearer picture of observational study designs. If you have questions, you can put them in the comment box and I'll be happy to discuss them to my extent. Thank you.
Thank you, Dr. Jagriti, for making these complex concepts so clear and engaging. To conclude, today's session has shed light on how the study designs form the backbone of much of our evidence in research. We've seen how each study type carries its own strengths, limitations, and unique application. Dr. Jagriti, we would like to know on how to choose a particular study design for a study. Could you elaborate on factors or criteria that guide the choice between a cross-sectional, cohort, and a case control for a given research question?
Yeah. So to decide how to how to select what type of design to be selected. So it's mostly based on the your research question, the feasibility, and what are the resources that are available for you. So on that basis, if you want to conduct a study for the RCT, but there are some any ethical or practical reasons that because of which you cannot conduct a proper clinical trial. So in that case, observational studies are the main baseline for formation of the data, where you can use them and you can go with the using any one of the cohort, cross-sectional, or case control study. Mostly, cohort study is the very widely used study design for the study purpose, because it gives a very clearer insight from the whole perspective. And obviously, if we want to compare a data from the two different sources, then case control study can also be done. So if you want to just simply understand which kind of case study or which kind of study design you have to use, you can use if you want to study a descriptive pattern, you can go for the descriptive design. And if you want to test the hypothesis about what are the causes, then you can go for the analytical design.
Thank you, Dr. Jagriti. If you have any other questions or queries, please make sure to reach us at fcpiofficial@gmail.com. On behalf of Federation of Clinical Pharmacists of India and Clinical Research Forum, we extend our gratitude to Dr. Jagriti for an excellent session on observational studies. Your expertise and knowledge were instrumental in helping us understand observational studies and its applications. The key takeaway is that choosing the right design is not just a methodological decision, but a strategic one that shapes the quality and impact of our findings. As researchers, practitioners, and learners, our responsibility lies in applying these insights thoughtfully to generate reliable evidence for better decision making and improved outcomes. Thank you, Dr. Jagriti, once again. Thank you all.